Hi, everybody. Okay, we're going to look at part 2 of health promotion today, and today we're gonna focus on monitoring, how health is monitored, or the sort of areas that are monitored in health, and a little bit about the groups who influence health policy. So this will address, I think it's task 1. Let me just check. This will address task 1 in your assignment. Okay. We'll be looking at criteria 1.2 and 1.3. Identify the potential groups who can influence public health policy and explain how the government monitors the health of the nation. Okay, so we're going to be focusing on that today. Okay, so as I said, we're going to focus a little bit about the monitoring of health, the sort of things that get monitored, and they may be countrywide, they may be international. Okay, and then we're going to look at some of the sort of people who will influence the policy being made. Okay. Okay, so health is comprised of 3 dimensions. We've talked about this a little bit before, and we know it's not just about the physical health, as I said in our last session. We've identified that social health is important, and we all know now that mental health is important too. So you put the 3 areas together and create a package of what is known, would be known as good health. So if I asked you for examples of, what would be physical health, if we're identifying when someone was physically healthy, what sort of things do you think we'd say? So the sort of things we'd be looking at for physical health would be body systems would be functioning. You'd be a healthy weight for your height. You'd be free from disease or illness. General physical fitness, yeah. Healthy blood pressure, healthy cholesterol level, and joints and muscles would be nice and flexible. If you saw someone with all those things, you would probably say they were physically healthy, yeah? Does that make sense to people? So these are the sort of things we'd be looking at if we wanted to monitor someone's physical health. So let's have a think about the next point. So if they were examples of physical health, what do you think would be examples of social health? How would you know if someone was socially healthy? Have a guess. Let's see what I've got. Communicating effectively, making a network of friends, accepting responsibility for action. So, being there when you've done something, saying that you've done something, or making decisions about what you do and why. Obeying the laws and rules of society. That is actual good social health, because it's about functioning well in society, yeah? And to do that, you tend to obey the laws and rules of society, the norms of that society. Taking part in activities, a variety of activities, socially, and interacting with other people during that. Now, they might always not be your friends. You might be interacting with other people on all sorts of different levels, with work colleagues. You could still be friends, but they might just be work colleagues, or your bosses. There's a sort of different way of interacting. And then, you might go to an exercise class and interact with people there, or you might go to a dance and interact with people, So there might not be people but when you go to a restaurant, you interact with waiters and waitresses, those sorts of stuff, the kitchen staff. And it's about interacting with them socially well. That would make social health. So, they're not all friends. You have different sorts of relationships. A different relationship with the person in your local shop but you have some sort of interactive relationship with them. As I said, it's not the same as you have with your friends. And the relationship you have with your friends is not always the same as the one you have with your parents or your siblings or your grandparents. So there's all sorts of different relationships, and carrying them out well and in a way that you're happy and satisfied with shows good social health. So let's think about the last one, which is mental health. So what sort of examples would we look for to know that someone was mentally healthy? Let's see what I've got. So we've just been talking about coping with stress, and that leads to positive self-esteem, doesn't it? So being able to, stand your ground, and, be confident with doing things. Recognizing and expressing feelings. When you do have feelings, and we all have upset or difficult feelings now and then, they can be simple, they can be complex, but being able to share them with other people and talk about them and sort of resolve them and move on is a sign of good mental health. So being able to share those feelings within a reasonable way. Have stress coping mechanisms, as we've said earlier, to be able to support and help your family when they need it, or when sometimes somebody else is having a difficult time. Instead of falling apart, if you have good mental health, you should be able to be supportive to others who maybe are going through a stressy time. To function well in society, within the role of the job that you do, and to, when you're communicating with other people, to not be paranoid or not to mistrust too badly. We all have trust issues sometimes, but to be suspicious of everybody and to not trust anybody is often a sign of poor mental health. And just generally be able to cope with the demands of everyday life. Okay, so those are the sorts of things we're looking for when we're looking at examples of good mental health. Oops. Okay, so the notion of dynamic health, we use the word dynamic. It doesn't mean, it's like a Marvel thing. They don't leap massively. We use the word dynamic because there's another sort of meaning to the word. It means it doesn't sort of move along on a flat line. It can go high and low, peaks and troughs, really. And nobody's health can remain the same all the way through their lives. I mean, you might be lucky in your 20s and your health can be quite stable, but the longer you live, the more health ups and downs you probably have. So it's almost impossible that someone could be in optimum physical, mental, and social health all the way through their lives. We do have dips, but the most important thing is being able to overcome them. Okay, but when we talk about optimum health, so if you read in government policy about optimum health, that's really when you're maintaining a good balance of those three different dimensions we just talked about, of the physical, of the social, and of the mental health, a nice, even balance. It does not mean that you have to be perfect in each one of them. We've all got little areas that we could probably improve. A lot of us could be physically healthier than we are, a bit fitter, a bit stronger, a bit less fat, or a bit, need a bit of weight put on or something. But it's a balance of all three, really. Okay, so we're not looking for perfect. When we say optimum, that sounds perfect, but it isn't. It means a good balance, generally performing well. So measuring health status. This is what people need to do to create government policy. We need to look at the people's health status, where they are, and we need to analyze it, or well, not necessarily us, but the people who work for the government. Okay. And it's really, when we're looking at health status, what we mean by the phrase health status is, it can either be an individual or it could be majority of the population. We're looking at their overall level of health, and then the sorts of things we take into account are factors such as life expectancy. How long do we expect people to live? And this is obviously quite a generalized thing, because you can't ever really calculate for accidents. Okay, so whenever we talk about a life expectancy, the average life expectancy of the UK is about 80 something. We never calculate for accidents, because that's just too haphazard, really. So the fact that we can all get run over by a bus tomorrow is very hard. There are probabilities, there are mathematicians who could probably do it, but that's not when we're looking at health policy. We're looking at, just possibilities, really. We're looking at how health is maintained. So it takes into account the factors such as your life expectancy, the amount of disability, if you have a long-term disability, and the sort of levels of disease that are around in the population at the moment. And analysing health status and some of the trends, whether it goes up or down, and the sort of movement, gives you an optimisation of the health of a population. And it's this information, as I said, that the government, the policymakers will use to decide if they need to act on certain areas. And they use it really to predict, so that they can plan health services, make changes, maybe make some new developments, do some research, plan a workforce, where they're going to put the staff, do they need to open new hospital wards? Do they need to close down some hospital wards? Do they need to reduce some specialities because it doesn't happen very much now? All those sorts of things. And these trends can really help the policymakers, who are always working 10 or 20 years into the future, if you think about that, because something such as, for example, the NHS needs massive year planning, really. How do we want the NHS to look in 2030? How do we want it to look in 2040? And you need some of these predictions to actually be able to do that. It might make you think about where you need hospital or health services. Is there a problem in this town? Is there a particular issue? Do we need more GP services in the area? Do we need to build another hospital here because the population has expanded? Or do we need to close one down and move it over there because population has moved? So lots and lots of things to do with planning. And also budgets can be set, and this can be local budgets in the GP's practices, deciding where they need to spend more money. Is there a prevalence of certain illness in their community that they might have to maybe spend some more money on? The same with hospitals, opening, closing wards, as I said. Do they need more breast cancer screening? Has the population required more? Is the clinic getting overcrowded? All those sorts of things. These trends help them with their planning. Okay, so why are we talking about measuring health status? Because it's really, really important for local planning and government planning, and also international planning in time, when you look at some of the things the World Health Organization does. So what sort of things are measured? A lot of these things are measured in every country, or every forward-thinking country anyway. The sorts of things you'll see measured, and these, if you look at some of the government statistics in Malaysia, where you live at the moment, you'll see that some of these things are definitely measured there as well. Sort of thing we look at is life expectancy. Like I said, how long do they expect people to live? And that goes up and down depending on all sorts of different situations. Depends on people's social situation, like where they live, the standard of living, if they live in an area with a lot of disease, or if they're wealthy and have access to all the services they want. That will affect people's life expectancy. And there's coming out of that, there's a sort of newer statistic which they look at now called the health adjusted life expectancy. You may see that one mentioned sometimes. That's the number of years a person can expect to live in full health, because they are accepting the fact now that due to modern science, people live much longer now than they did, say, 10 or 20 years ago. Lots of people are living to 80, 90, 100. But are they living in full health? Maybe not so much in those last 10 years. We don't know. So what they're doing is now they're doing a lot more research into what is known as the health adjusted life expectancy, when that, how long people are living in full health. And then that's giving them an idea of how often, how long people might need some extra care and support. You might hear the phrase mortality, and that's really the mortality rate is, the rate at when you die, basically. So they might use a mortality rate for malaria, how many deaths are caused by this particular disease, or it could be an environmental factor. What's the mortality rate of living near Chernobyl or something like that? So how many deaths are caused by that effect? And what's the mortality rate in general? This could be affected by social conditions as well. So if you've got a country which is sort of quite poor and impoverished, you might look at mortality rates. Are they below the world average? If so, what's going on? Why are people dying so much younger? And the other thing you will hear is something called morbidity. Morbidity is how frequently something occurs in the population. And this will be, so you might look at a particular illness. So you might say, what is the morbidity rate of breast cancer in the UK? What is the morbidity rate of congenital heart disease in the UK, for instance? What's the morbidity rate of dengue fever and malaria? Those sorts of things. In Malaysia, sorry. So morbidity, so get to know these phrases: life expectancy, health adjusted life expectancy, mortality, morbidity, because you want to mention at least those few in your assignment. Another more common phrases are things called incidence, number of rate of new cases. Okay, so if you'll see in your research the incidence of, it means how many new ones there are this week, say, for instance. Prevalence, the total number of people with a condition at a specific time. So the prevalence of heart disease today is, and then you'll give the figure. Now, these sorts of things they're used in different countries. So you need to sort of just be vaguely aware of them, really. The most commonly used one is DALY, daily adjusted life years. And this is a measure of the years of healthy life that are lost due to premature death or severe illness and disability. So again, it's looking at the amount of years that someone remains healthy. And DALY is often used a lot in third world countries where there's there's maybe not enough food, not enough employment, poor environmental conditions. So where they're having to look at how this is affecting people's health, why people are dying earlier. they will use the dailies or DALIs to explain that. And DALIs are often created through two statistics, the YLL and the YLD. So years life lost and years of life lost due to disability, and they're sort of added together really, and you get that. Okay, so you don't really need to explain the breakdown, but you might find a piece of research about the DALIs. Burden of disease, this is the impact on healthy life really. So you might often see something written up as the burden of the disease. The burden of heart disease is this much. So just familiarize yourself with some of these phrases, okay? Because as I said, you're going to have to do some research to answer your question. And you want to be familiar with these phrases. So you don't want to sort of get them the wrong way around, because you'll have to explain some of them. Some other common measurements that we look out for is usually around children, okay? To find out the well-being of a population in general. The other ones tend to be more about adults, but we're really looking for children here. We'll be looking at under 5 mortality. So children who die before reaching their 5th birthday. And these mortality rates can be different. It's often under 5s, but if they're looking at a particular piece of research, they might want to look at under 1s or under 2s or under 3s. But they're really, they're looking from newborn to the age of 5 very often. And there's a belief that the under 5 mortality can give a really good indication of the population's general health status, because that includes economic development, education, and how available health services are usually, because the knowledge and the skills are there often to keep these children alive. So it's, finding out, delving into it once they've got that statistic, to where the weaknesses are and where the failings are. So when they're looking at the general health of a population, the infant mortality, whatever age they choose to use, is, it's usually between 1 and 5. Infant mortality is an important indicator. Okay, then we have to think about measuring the determinants of health. Okay, so the sort of factors that impact health. So, and this splits into 3 as well: biological, behavioral, and social determinants. Biological, it's really sort of fairly obvious. It's about things that happen inside your body, what goes wrong with it really. So it could, and these could have a genetic impact. It could be something that's inherited. You might inherit a disease from your parents or grandparents. There could be hormonal problems, some sort of imbalance in your body, body weight, too high, too low, cholesterol levels, blood pressure, too high, too low. And it can start from birth weight. A baby that's born sort of premature or extremely low birth weight can often have health problems much, much longer, and sometimes for all of their life. Oops, sorry. Okay. So the behavioral determinants, so the first part really is, in your bodies, you don't always have control over it. Sometimes your body goes wrong and it's not your fault. Behavioral determinants are really more about your choices and the population's choices as a whole. So the sort of things we may measure are just the different patterns of living that people have that might impact their health, okay? So these will be things like, alcohol, smoking, sexual activity, physical activity, or not enough physical activity, eating habits. These are things that people are making choices about, really, knowing that sometimes they might be damaging to their health. So a lot of guys who measure them will look into it and try to find out, maybe try to find out a bit later on why they choose to do these things. And that's often a big role with health promotion, is talking to people about these habits and behaviors, really. So smoking, we know that smoking's gone down, but lots of people vape instead. We don't know how good vapes are, so the jury's still out a little bit. But so they will still be gathering those statistics and also doing lots of research as well. And the last one is social determinants, because we know now society can impact health, and particularly the environment that you live in. So some of the examples could be, people living in a very poor situation, where they're living in an overcrowded place, or the home isn't very hygienic, or it's dangerous, or they don't have electricity or gas or heating. It's not always hot. Even in a hot country, it's not hot all of the time. Sometimes it's cold and you still need heating, or you need heating to cook, so you can't eat hot food. Transport issues, you can't travel places, you have to walk everywhere. All of these social determinants can be wearing on health. Young children might having to go to work to help maintain the family, so they might have to do work that they're not physically fit and strong enough to do, but the family needs that sort of help. So all these sorts of things would be classed as social determinants, but we know now, as I said, we never used to consider that they affected health, but we know now that they do. Who are the people who monitors them, and why do they do it? We know that they try to gather this information to help them decide policy, to help the government decide how they're going to spend their health money and what they're going to do with it. The people who gather it are known as epidemiologists. Okay, this is a particular science, which is the method used to find the causes of health outcomes. So epidemiology looks at the causes of health outcomes, and it looks at the progress of diseases in populations. So in epidemiology, the patient is the community, and individuals are also looked as a collective. So they look at people individually, but they also look at collectives, like groups of population as well. Okay, so it's very data driven, and they look at things like frequency, patterns, where there are high trends. And as I said, it's not just disease, because they might look after a disaster. You might have epidemiologists go in after a disaster has happened and to see how different areas have coped. So they would be gathering statistics on that, what's the, so it can be the sort of recovery situation. And the role of epidemiology is sometimes to help try to control health problems by providing the statistics ahead of time so that people can take some action as well. So they can also reflect on his history. It's the same way as all scientists do in that sense. They try to have a look back at what's happening. To think of the most active sign of epidemiology during the COVID-19 pandemic, I'm guessing it was probably the same in Malaysia, but on the news nearly every other night, or so many times during the day, there was people monitoring the statistics of who'd been vaccinated, what towns had higher levels, where there were outbreaks, what hospitals were suffering. So you could see different areas of the country, what was higher, what was lower. All that's carried out. The epidemiologists all over the country were working very hard during the pandemic, looking at so many different types of statistics. And then they were looking at, how many people of a certain age had the right vaccine, and they were trying to work out whether this was having an effect on the movement. And then they were looking at the different variants, you know, the alpha, the beta, the delta, the omicron. And they, you know, was there more with this one or that one? So is this one a more dangerous variant? And the whole purpose was to give the population information, but also to enable the government to say, you know, where do we have to put some extra resources? That town's got a problem. Do we have to lock it down more than that town? So it was helping with lots and lots of decisions. Okay, well, that's pretty much the sort of issues around monitoring. So as I said, you will have in task 1, task 1.3, you would have a question, explain how the government monitors the health of the nation. Now, you've got 3 tasks and you've got 300 words for task 1. So I would say each task you probably might well allocate 100 words to. But you can change the balance. So if you think you've got more to say on 1.3 than you might have on 1.2, which is probably true, you can overbalance it as long as all 3 tasks add up to 300 words. Okay, so it says explain how the government monitors the health of the nation. So you might want to write a little bit about the role of the epidemiologist, and then maybe write about some you know, pick some of the most important areas that I've just discussed, and just identify them there. Okay, so who develops and influences public health policy? Well, in this country and in most countries, it's developed by the government. Okay, and here we have a picture of our Chief Medical Officer, who's Professor Chris Whitty, slightly sort of funny looking guy at the top. And the one underneath is the Secretary of State for Health. So he's the politician. So the guy up top is the chief doctor, basically, Chief Medical Officer. And he's responsible for Public Health England. So he's the most senior doctor in Public Health England. And his job is to gather all the data and take it to the government and explain it to them in words they can understand. So they don't always understand it. Now, the person who's particularly responsible in the UK is the Secretary of State for Health. He's a member of the cabinet. He works to the Prime Minister. And we, you know, with our cabinet, we have a Secretary of State for Health, a Secretary of State for Finance, a Secretary of State for transport, the environment, all sorts of different, there's about 12 people on the cabinet. But his responsibility is health, and under that responsibility comes the NHS for him. So he's responsible to the NHS. But he needs information, so the information will come from the Chief Medical Officer and some other specialist advisors. So the Department of Health is responsible for developing public health policy, okay? And the Secretary of State for Health, Sajid Javid, he's the guy who has to go to Parliament and talk about what's happening. He's supported by the Chief Medical Officer, and there are some other advisors as well, okay? So the Chief Medical Officer, alongside the role of advising the government, he's also responsible for developing all the policies and plans to actually put programs into place to protect public health. He's got very much a public health protection role. And he's like the CEO, really, I suppose, of Public Health England, although there is someone below him. And he has to make sure that the policies are okay before he passes them on to be carried out. And if he's unhappy, he might bring in a specialist advisor to explain to the government why that won't work. but he ultimately sort of tries to take responsibility. So the idea is it's about protecting public health and also reducing health inequalities across the country. Okay, they're very aware that there are, you know, some areas of the UK are richer than other areas of the UK, and there are, coming out of that, there are health inequalities as well. Some areas where have much higher populations, so healthcare gets spread a lot thinner. So their job is to monitor that and to try to, you know, try to fix it, really. And this would be the same, as I said, in most countries with a democratic sort of government. Now, I think you have a similar system in Malaysia. Okay, so who are the influencers? We know the chief medical officer advises, but so who influences this decision? Now, there are a lot of stakeholders, people who, you know, who work in healthcare and want to influence policy. I suppose we all want to, we'd all love to influence policy if we could, but, you know, it doesn't always work out that way. So in the UK, health is a devolved issue because there are 4 countries. So each country, Wales, Scotland, Ireland, and England, they have a certain level of responsibility for the decisions and the timescales and how they put things in practice. So if you watched any of the British news, as I said, during the pandemic, we might have done something in England maybe a day or 2 before Scotland, or Scotland might have made a slightly different decision. You know, there were some differences during lockdown, which caused a bit of a fiddle faddle, because some parts of one country was locked down when the others weren't. So people kept driving across the border so they could go out for dinner and things like that. It was all a bit stupid. So sometimes they didn't always bring it together because it is a devolved issue. So all legislation for health is done locally. But there are some overarching policies where the government, the UK government, can actually sort of override them sometimes and say, we have to do it this way. But I'm going to give you a brief overview of some of the sort of audiences who try to influence policy. So one of the biggest groups of people who try to influence policy are politicians. They may have their own agendas. Remember, they are members of parliament, so they represent communities, some big, some small, depending on, you know, where they are. And some of them take very specific positions on policy that they're particularly interested in as well. So they may work on certain committees and excuse me, may ask to be involved in a certain policy. We have a few people few MPs in Parliament who used to be doctors, and they're very, very interested in the development of health policy and that. So they will often take an interest. So if you're doing a piece of study, some of your politicians might want to take part, might want to make a comment, and they're good people to engage with. Also, because they're MPs, they have very quick access to the cabinet and the Prime Minister. So, you know, there are a lot of pressure groups from outside, you know, like the smoking lobby and that, who do try to talk to them. Sometimes they're good people, sometimes they're not good people. Civil servants are the long-standing people who work for government, who don't change their job when people get re-elected, because they're the administrators who are there all the time, okay? And they don't really move around quite so much because they go into a job because they've got certain skills and they might stay in that job for years. So they often know more about the policy development than the MPs, who might just come in, you know, into a brand new area and have never done it before. So the civil servants are people that can be relied on to help with developing policy. And because of that, they can actually be quite influential as well. They can advise the Prime Minister that this isn't a good idea because you know, 10 years ago we did it this way and then it failed, and you know, this is why, because they have that knowledge, and they have those extra bits of skill. So they are often advisors. The Prime Minister also takes on specialist advisors that are just particularly good in their field, and he can just hire them, you know, just, you know, for a few hours a week for a specific subject as well. The other influencers in health policy are the statutory bodies, and these are people such as those who work in the NHS England, okay. There's also Healthcare Improvement Scotland, because as I said, the different countries have their own ones. There's the Healthcare Inspectorate in Wales. People who work in the NHS, they don't set policy, they actually carry it out. But sometimes they can get some of the smaller policies devolved to them, or they can at least create the procedures that carry out the policy. But again, they're generally experts in their field. So if you wanted to do something around midwifery services, you would go to some of the midwives in NHS England and you know, consult with them really. So they can influence policies too, because they can say, well, no, that doesn't work, that does work. In addition to that, we have professional sector bodies, and that's just another step. So that would be like the nurses, the doctors. So the General Medical Council, that's the GP, that's the doctors. Nursing and Midwifery Council sort of speaks for itself, really. They're the nurses and the midwives. The Royal College of Nursing, that's sort of the nurses union, and the British Medical Association is the doctors union. But they can be quite influential as well. And of course, they can actually withdraw their labour if they want to, if they're really unhappy about something. Although I've never known doctors to ever go on strike, and I've only known nurses to do it twice in my lifetime. So, and then only for very short times, and where no emergency departments were affected. So because of the work they do, it's quite difficult for them to take industrial action compared to like, you know, dockers and bus drivers and things like that. They don't feel that they can do that, but they have taken some action when they're really unhappy about some policies. So and the other thing is they are influential because there's an awful lot of them. There's an awful lot of doctors and there's an awful lot of nurses. So across the country, they have quite a strong voice. And even if they don't take action, they will write articles, which, you know, can cause the government a bit of difficulty. They'll go on TV and do interviews, the leaders of their bodies will. So they do have a power. The other one that can be, the other very large union is also the teachers union, because, you know, there's a lot of them as well. It doesn't necessarily mean they get listened to, but they do, you know, they can influence policy. And sometimes the government will give into small things just for a quiet life so they can get on with doing other things. So who else influences policy? Well, there are people from the third sector. And when I'm talking about the third sector, I usually mean charities. So they often call them the third sector, you know, non-profit making organizations. And in health, there are quite a few. And the charities, they develop around a particular illness or a problem, and they become a very important support group for people with that problem. I think my examples here are Diabetes UK, British Heart Foundation. They support research, you know, heart research. Alzheimer's Society, particularly interested in, you know, supporting dementia. They can be really effective influencers because they're very much on the ground floor, and people talk to them because they're not medical, but they're not always medical professionals. They may have some working with them, But they are very good at providing evidence, and little bits of research are carried out with their support. So they often will come to cabinet committees, and they will represent a whole group of people who suffer maybe from heart disease, and they might come and say, we're unhappy with this, we'd like you to do some work on that. And they can really, really represent people. They also offer lots of care and advice and support, activity groups, care homes. They do quite a lot for their particular communities, but they're very, very focused around the sort of illness that they're representing, really. They also raise money too. So you might find they raise money for local care homes, the local hospitals, to have a specific piece of equipment, or just to fund certain pieces of research. And because of that, and because people have a lot of respect for them, the general population has a lot of respect for a lot of the third sector charities. They can be listened to, and they also represent the views of a huge group of people quite well. So the government usually treats them with courtesy and very often listens to what they do. Now, these are the sort of influences that happen within an individual country. You may not have the same charities where you live, but you will have some others. And they will be specific to the needs of the country that you live in. There will always be somebody. But as well as that, there are the big international health influencers. Really, really important. And one of them is the World Health Organization. I guess most people have probably heard of the World Health Organization. We talked about them, about their development on Tuesday, and the fact that they're completely international, and they set policy literally at a world level. I mean, obviously they have to get the buy-in from different countries, but once that, most countries have agreed that the World Health Organization do what they do. So when the World Health Organization makes a statement about something, they are very influential on the policy of the country, because even our Prime Minister would listen to the World Health Organization. So they would have a strong influence in any country that they were talking to, because they're speaking for the rest of the world, really. So they as I said, they create a world view, and they often get countries to look outside their own premises, because while something's okay in one country, it might not be okay in other parts of the world. So they'll be drawing people's attention to other parts of the world to let them know what they could be doing. Okay, so very influential, always worth a mention. Other national, international organizations are people like the World Bank, the United Nations Children's Fund. They work with children all over the world, again, in all sorts of different circumstances. And Doctors Without Borders, or Médecins Sans Frontières, who will travel to anywhere in the world where that sort of medical help is needed, usually war zones, disasters, crises, things like that. Okay. So the World Bank and the United Nations have influence because they have money, and they give money, and with money comes influence. That's what, if you ever want to remember anything, remember that. Okay, it's unfortunate, but it's true, and it doesn't matter where in the world you are, that's the truth. So Doctors Without Borders, they are very altruistic. They will go anywhere, and they will work with anyone where there's a large disaster or war, where there's a large problem, because they are very organized, and they are an international organization. but they all do it for free. They're usually doctors who work in hospitals all over the world, and they take the time off. Often their hospital contracts allow them to do that if they work for these guys. And but it is a charitable thing. It's done, you know, there are no charges. They raise money. I don't know how they raise money. Fundraise, I think, so they have the equipment that they need. And sometimes they do get a little bit of help from the government just to keep, you know, to pay for their equipment. But they will go anywhere and they will work with anybody. They don't have a lot of influence in the sense, because, you know, they don't come bearing money or gifts. But what they do have is knowledge. And the fact is that they often see the hard stuff on the ground, you know, the ugly stuff. So what they can be relied on to is to bring information back. So most people rely on Doctors Without Borders, Médecins Sans Frontières, to let people know that you'll often see them being interviewed in news because they are trusted to be very neutral. So they don't have a political bias in either way. So what they'll do is that when they're in there, people will interview them and they'll tell it fairly honestly about what they're seeing and what they're managing. And that's quite important in a war environment where there's a lot of propaganda going both ways. These guys sort of tell it like it is, you know, so they can't be influenced by politics because they don't owe anybody anything. So in that sense, they're very neutral and they'll just go in there and they will care for people. Their influence is stronger with the people on the ground because they are very well trusted. So if you're in a war zone and you don't know who to trust, and these guys turn up, then people do trust them. Okay. But yes, they don't have the influence that other people. So when you're writing an article about influence, although they're really important and do an incredibly important job, some might say a more important job than the other two, almost in a way, because it's real and it helps people immediately. They don't have the same influence, but they have a huge amount of respect, and governments tend to respect them, and they will listen to their opinions. You know, they will hear what they're saying because they're considered neutral. Okay. I've given you some references as well, and I've also added onto Google Classroom a chapter from a textbook about public health. So I'm not expecting you to read that all overnight because it's quite chunky, but it's something that you could read as this unit goes through, just to give you even more background information, just that added little bit of detail, which might help, you know, put something a bit more interesting into your assignments. So goodbye to everybody, and I will see you Tuesday.